One of the most important things to consider is the need to really do a thorough risk assessment. We also need to consider the community, the wider community, as well as the well-being of the staff members who are, or the teachers who are going to be taking care of these children at school. That said, we do know that school and reopening of schools is really important to the well-being of children. First of all, the children need that education. Schools usually provide an avenue for social and behavioral development. One size doesn't fit all, and even in one country, you may find that you may have to make several adjustments based on age group, based on the transmissibility of the disease, whether it's clusters or whether it's community transmissions and so on. Children typically have milder symptoms and the disease is usually less serious in children, and some of them, most of them actually go unnoticed because they don't manifest these symptoms like adults do. We also do know that children under the age of 18 account for only about 8% of all the cases globally. In some cases, children have had very severe progression of the disease, sometimes requiring critical care. If you have children who have comorbidities, you may want to take additional precautions, just like you would do with an adult population with the same comorbidities or similar. We may need to take into consideration the different age groups and how they understand the precautions that need to come into place. Distancing tables in classes or desks in classes, maintaining that 1 meter distance where possible, ensuring that there's appropriate use of cloth mask. We need to empower parents, the schools themselves and various communities to know that if they have a sick child or if there's a sick teacher, they need to stay at home. We need to understand the need to detect in the community, detect cases in the community, isolate the cases in the community, and be able to seek the treatment that they need. It's only through these combined efforts that we can safely reopen these schools.